Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Of course, joined with me here in the studio is Doc Hawk, whose chair is going up and down magically. Oh, well done. And we're also joined this morning in our Studio B by Christy Bartlett. She's one of our outstanding palliative care medicine physicians, and we're going to welcome her to the show in just a moment. But first, we want to make sure that you watch to the very end of this program because we have a very special mask video that you're going to want to watch because it's going to start your week off just right. But in the meantime, Hawk, how are the numbers today?
We're looking really good going into the weekend.
I like it.
So I think if everybody can celebrate the weekend and the holiday responsibly, we can continue to have low numbers. So right now we have 18 patients in the hospital.
Wow, that's our lowest in a long time.
Which is really good.
That's awesome.
About half of those are in the ICU, 7 are in the ICU, 2 are on the ventilator, and I should note that in the ICU, our age range, so of those 7 patients, a 32-year-old up to an 88-year-old. So it is still young people.
And to say we still have a number of people who are, quote, COVID recovering after their first 10 days who are still on a ventilator.
Yeah.
How many of those are there?
Yeah, there are about 4 of those on the ventilator still.
Okay.
So we've been having anywhere from 4 to 6 this last week. In addition, on the regular medical floors, the people, the age range is from 30 to 80 as well. So again, young people are in the hospital. We should also note that in August, we did have 16 deaths. So that's almost 1 every other day. So far in September, we have had 1 death as well. So certainly more discharges are better, less deaths are better, but the numbers are encouraging right now. And overall, the running 7-day average in the Kansas City area of total cases has been decreasing these last 3 days to where it was about August 25th. So that's good as well. As long as we can keep that running 7-day average decreasing and as low as possible, I think we as a health system and we as a community are going to be a lot better off.
How is it in the state of Kansas, though? I think they're running 7-day total there. How does that look?
The state of Kansas is still kind of up there. We know that some counties, which have, again, smaller population numbers, but have higher test positivity rates because of that, are seeing more cases overall. So the numbers are a little bit increased compared to the Kansas City area specifically.
Yeah, and I think Missouri's high too.
Yep.
So Missouri and Kansas. Those are the real warning signs, especially as we open up schools, et cetera. Well, Dr. Bartlett, how are you doing today? Welcome to our program.
Thanks for having me.
Well, we're delighted to have you. How's it been on the palliative care service right now in the COVID world? What's that been like?
It's been different. We've kind of modified our team. Usually we do a lot of goals of care and symptom management, but in the day of COVID, we have a palliative care team that's specific to the COVID patients, most of those the ones who are in the intensive care unit. And we've really taken on the role of helping with communication for patients and their families because they're not allowed visitors. It's very hard to get information. So we've really been trying to help the intensive care doctors and the patients and their families, just facilitating communication so the families are staying updated on how their loved one is doing. Of course, we are also helping with, the really sick patients and end-of-life care, ensuring that they are as comfortable as possible and well taken care of, and just providing that extra support through that process.
Yeah, well, thank you for the great work you do. I was working in the ICU for a very long time, and it started a very long time ago, probably after Dr. Bartlett was born, before she was born, I guess. And I remember back in the mid to late 90s when palliative care started becoming a thing, and I think now, oh my gosh, it is so much better, and because of the great work that you and your team have been doing, and special thanks and hats off to all of you guys who do that. That is great work. That's God's work right there.
Thank you.
Just wanted to talk for a moment about this coming weekend, and we're going to talk about this throughout the program today. Labor Day weekend is traditionally a time to get out and have a lot of fun, and that's a good thing, but it doesn't mean you should do it without wearing a mask or without distancing.
Right.
I know there's a lot of weddings this weekend. I know there are going to be a lot of big group gatherings. Those spook us a little bit because what we know is that when people went back out and partied a lot or they were in their weddings are especially notable, big church services, any place people are congregating together, especially with alcohol, they tend to lose a little bit of inhibition, and then all of a sudden the masks aren't up, the distance is shrinking, and the virus is spreading, Dana.
Yeah, absolutely. And, there continues to be good evidence to support this. Peer-reviewed journal articles. There was a recent publication in Clinical Infectious Diseases this week, which is one of the major infectious disease journals, just like the New England Journal of Medicine, which looked at public, not healthcare. We have a lot of information about healthcare workers and wearing masks and eye protection, but the general public, and what are they doing to reduce the spread and reduce their risk of getting it. And what they found was actually the social or the physical distancing and the masking was negatively associated with getting COVID or having a COVID positive test. So what that means is doing those measures, we actually continue to have proof and more proof that those things protect you from getting COVID. One of the other risk factors was riding public transportation. We don't have a lot of public transportation here, but certainly even on public transportation, wearing a mask and distancing as much as possible is what is going to help reduce your risk of getting COVID.
And remember that we know that partying really makes a difference in big group gatherings, because we've seen what's happening in a number of counties. But before, we're not hotspots. We're talking about Riley County, Atchison County, Ellis County, Douglas County.
Yes.
And what's there? Fort Hays State, K-State, Benedictine, KU.
Yes.
So, we just have to be safe, because we're going to have therapy, we're going to have vaccination, things are going to get back to more of a normal life. But we have to fight for our right to get there.
That's right.
All right, we're going to talk more about that at the end of the program today. So today is the day where we start answering questions, and these are questions that have come in throughout the week. And so, it's really important for us. We try and compile those into kind of these big groups, and then we say, okay, what are the key questions we're hearing we need to answer? So today, we're going to start off with the first one. Let's hear what it is.
Hey, good morning.
Good
morning. So it's that crystal ball question. What do you wish you would have known at the beginning of the pandemic?
What do we wish? Okay, you take the first swing at that, Hawk.
Man, that's a loaded question.
It is loaded.
There's a lot of things I wish I wouldn't have known, that's for sure. Like how difficult it would be to continue to endorse the message of these simple things like mask wearing, like physical distancing. What do I wish I would have known? Really how long this will go. Because we know this is taking a toll on people. We knew initially in the original stay-at-home orders and the shutdown that it was hard for people after a week or two. I wish I would have known how hard it was going to be this far into it. For the physical, the emotional, the spiritual. Because we do see a lot of people, and you've talked about it, the cows, the COVID weariness syndrome. It is very real, and it does take a toll. But we all have to continue to be vigilant, find joy where we can find it, whether it's through our faith, through our services, whether it's taking a walk, looking at a sunset, anything that we can do, because this will continue to go on. We just don't know for how long. Hopefully the vaccines will make it better. Hopefully there are a lot of drugs that are being studied. Those therapeutics will make it better, and we can get back to some semblance of a normal life.
Dr. Barlow, what would you say in answer to that question?
Yeah, very similar. I think, I saw in my own grandmother who lives alone how isolated she was at the beginning because we were so diligent about keeping her very isolated. So I think I wish I would have known how effective masks are in keeping people safe, and then we probably could have integrated her back into our family a little bit sooner. Fortunately, she's doing great, and she's spending a lot of time with our kids, being very cautious. But I think it would have been helpful to know that, hey, we can be around Gigi. Let's just wear our masks. The other thing I wish I would have known is to invest in some good scrubs. Instead of like the cheap stuff, because this is all I wear every day. So I would have bought better scrubs earlier on.
That's a great answer. I wish I would have known that history repeats itself like this. That mask wearing would be a political tool in a political fight, as much as a healthcare fight. That people in some cities would do a great job of wearing masks, and we'd watch their death toll drop, while others were not going to. I wish I would have known that we weren't going to replay 1918, in 2020, because we really have. If you look at what was going on in the pandemic of 1918 with influenza, we're really very similar in terms of how people are reacting and how people respond to it. I think they're responding in that way first because sometimes mask wearing and coronavirus has become political, which just disappoints me so much, because it doesn't need to be political. It needs to be a rational, thoughtful medical discussion. And in that thoughtful medical discussion, I believe that if people make a decision to take risk on their own, that's their choice, and that's okay.
Yeah.
The problem is when they try to force risk on others by that choice. So I wish I had known how to affect that discussion so it didn't become what we called the other day flapjacking, where people would flap their arms and jack with the truth.
That's right.
Because that's just wrong. What we needed to have done, I wish we could have done, and I don't know I'd even know how to do it now, is to talk about this in a calm voice so that people can make a good, fair choice. If they make the choice to go out and take risk, that's their choice. But it shouldn't be because they're angry or because of politics. It should be because you've made a decision in your life that the risk of COVID is greater to you or not greater to you than the risk of not doing the things you want to enjoy. That's an okay choice, as long as you don't push risk onto others.
That's the issue.
You know, you can't drive 120 miles an hour down a crowded street because of the risk to others. You shouldn't go out around a large crowd without a mask because the risk you give to others. If you want to go out and do things on your own or with someone who's in your bubble where you're all giving each other permission to act that way, then so be it. But just make sure you understand the choices that you're making.
And I think that's a good point that you make. Is it is your risk, but what is your risk of pushing it onto other people? We know from a wedding up in Maine or Massachusetts, I believe now, they had 65 guests there, but a lot of those have become infected, a lot of those guests, and those infections have now reached into local nursing homes and prisons as well. So it is the risk that you put on other people. And we also know from a recent study that although it is like the 1918 flu pandemic, the risk, especially if you are older, 60 and older, your infection fatality rate is double that of what influenza is. So
in that pandemic, and even higher than influenza today, because now we have effective therapy.
Right.
Yeah.
So.
Well, let's take a look at our next question.
Can you explain why the CDC reported COVID-19 as the only cause of death for 6% of total COVID-19 deaths? What does this mean?
Christy, this has been a statistics that has gotten out there, and people just don't understand what it means. We understand what it means, so help us talk about that with our listening and viewing audience today.
Yeah, I would love to. So I fill out a lot of death certificates as a hospice and palliative care physician, and a death certificate is really the story describing the chain of events that led to someone's death. So on a good, solid, complete death certificate, you will have a few different causes leading to the actual death. So it's actually really unusual for a death certificate to just have one cause of death. So really that 6% of death certificates that only list COVID-19, I view those as incomplete certificates. There is always something that happens between getting a disease and someone dying of it. So with COVID-19, that's usually things like respiratory failure, pneumonia, acute respiratory distress syndrome. So a good complete death certificate should list all of those things, which ultimately lead to the patient's death. So there's really nothing that you can read into the idea that only 6% of those death certificates only had COVID listed. I think a lot of people were really hopeful that that meant, only 6% of people, truly died of COVID-19 because that was the only thing that was listed. But unfortunately, that just means those death certificates were probably not filled out thoroughly and correctly.
Yeah, and also I think a lot of people who fill those certificates out tend to be learners. They may not be, fully completed staff. I mean, you got to know how to do it if you're going to do it, and not everybody does. And so, Dana, I've filled out as an ICU physician, pulmonary. A lot of our patients pass away, and fill them out all the time. And if you don't you list one cause, it's wrong. You got to list all the causes and all the health conditions that contributed to somebody's death, and usually that's multiple things.
Absolutely, it's multiple things. We know from a lot of different things. So setting COVID aside, we know that pneumonia is always exacerbated by obesity and diabetes and lung disease and these other things. That is no different than COVID. So yeah, again, I think Dr. Bartlett made an excellent explanation, and hopefully that will clear things up.
You bet. Jess, what's our next question?
Why is coronavirus so different from the H1N1 flu, from the regular flu and SARS, that we have to social distance, wear masks, and limit gatherings?
Yeah. Well, it is a lot different, isn't it? And people struggle with thinking it's different. They want to make it the same. I think that way so they can feel safer about it and give themselves permission to go out and do whatever they want. But the simple reality is that some viruses are worse than others. And RSV, that's a nasty virus, especially if you've had, for example, a lung transplant. Whereas, rhinovirus, not so bad. Normally coronavirus, not so bad. But this coronavirus is just different because of that little spike protein that lets it pry into cells and cause damage. And because of that, it is different, Dana.
Well, and I think it is different than MERS and SARS in a good way. Seeing as the MERS mortality rate was 35%.
And SARS was
10%.
Yeah, it was high, though.
So, 10 times more than what this is, essentially. So that is a good thing. The nice thing about SARS is that you really weren't contagious until about 5 or 7 days into your onset of symptoms. So we could easily track those, not we, because we didn't see anything here, but you could easily track those cases and isolate them and keep it from spreading. That's not the case with SARS-CoV-2, where you can be spreading the disease at very high levels 1 to 2 days prior to any symptoms, and then, of course, after your symptoms start as well. And so it is very contagious. But we understand that we don't know a lot about this, and we know that the virus can evade your immune system initially. We know that it can lead to a lot of inflammatory problems. We've all heard about the cytokine storm and the inflammatory processes that happen and the blood clotting that it caused. Those diseases don't do that. Influenza doesn't do that. We have fairly good drugs for influenza. We have fairly good vaccination. Also, with influenza, a lot of the complications and deaths come from those secondary bacterial pneumonias, for which we have very good antibiotics too if we can get you treated early enough. So it is very different in those senses.
Yeah, and it is different, and it is not the same thing as H1N1 or regular flu or SARS. And so we have to take these special precautions. And actually, quite honestly, with SARS, you had to do all those same special precautions too. So that's not different. But H1N1 flu and the regular flu, technically, you ought to do those same precautions.
That's the thing. We're not saying you shouldn't. We haven't historically because of it wasn't as contagious. Should we have been doing those? Probably. Would have cut down on hospitalizations and death from influenza? Probably, and that lends to all of the infections, all of the cough and cold viruses, but those didn't strike people or strike populations with the same vigor that this infection does and cause the overwhelming of healthcare services and essential services and all of those things.
Yeah, the key about this is it's also so respirable, meaning it gets spread so easily, and you can spread it because you're asymptomatic. That's why so many people can get it. And then once they do get it, it's got that spike protein, as we talk about, that pries its way into a cell and causes the damage to the cell, especially the lining of the lung and inflammation in the heart and kidney failure. And those things, and the brain, those are bad things, and they really complicate the story.
And that spike protein looks to bind to the ACE2 receptor on our bodies with even higher affinity than the original SARS. So that is one of the other things that causes this to be so infectious.
And we're hoping that that's going to be the weakness, because we can go after that dadgum spike protein with the vaccination, because if the coronavirus loses that, well, gee, the vaccine won't be effective. But if it loses a spike protein, the coronavirus is just a coronavirus. I'll take that trade any day.
Yeah.
Just next question.
I read flu season will be worse because people have been staying home, wearing masks, and not being exposing themselves to germs that would build the immune system. Is this true?
Just remember that everything you read on the internet isn't true. This statement is false. It's really false.
Yep.
And the Australian and South African data already proves it, Dana.
Yeah, it's really interesting. That is unequivocally false. The easiest thing to do is when you go to Google, just you can type in Australian influenza 2020. They have their Australian government website, which shows such an extreme difference between the last 5 years and currently where they are at. They probably have different culture for masking and social distancing than we have here, depending on what community you live in. But if everybody can do what the public health guidance is and adhere to that guidance, distancing, masking, hand hygiene, and especially influenza vaccination, you will actually be protected. And we are hoping, because of those things, we will see less activity of influenza this year. It absolutely is not true that using all those things will actually increase your risk of influenza. We're actually hoping it decreases.
Well, and sheltering at home isn't going to do it either, because what we know
Correct.
is that our bodies have germs on them all the time, right?
We
Our
inhale them,
mouth,
you
where
know.
we inhale them, and they're everywhere. That is not a thing. And you know, there's even some data out with little kids when they're first born. This is why you should be exposed to dogs and cats, because you'll have less likely
Yeah.
developing problems with asthma and other things. But that's one population. That is not this population. That's not the whole population. And in fact, all of us have bacteria and fungus and viruses in our mouths, on our skin, in our colon. It's everywhere around in our body. And our body is actually dependent upon a lot of those bacteria and fungus and things in our colon for the right kind of digestion. It's already in you.
Yep.
It's already on you. Your immune system is already primed.
Yes.
Do not believe this statement. It is false. Okay, I think we're clear about that. Okay, good. Jess?
I read some COVID-19 patients get pneumonia. Will my pneumococcal vaccine protect if I catch COVID-19?
Yeah.
Pneumococcal vaccine?
So we do recommend pneumococcal or the pneumonia vaccine for certain risk groups. The vaccine will not protect you from COVID-19 infection. What we hope that it does is that protects you from invasive pneumococcal disease, which is strep pneumoniae, which is a common cause of things like pneumonia. If you have bad pneumonia, you can also get infection on your heart. You can get infection in your spinal fluid or meningitis. So we would certainly recommend talk with your physician. If you are one of those risk groups that needs the pneumococcal vaccine, please get it because it can help protect you against invasive strep pneumoniae or pneumococcal disease. Now, will you get pneumococcal disease or bacterial pneumonia after COVID-19? There are prospective ongoing studies looking at that. Right now, the biggest prevailing evidence is that those types of bacterial infections after COVID-19 or during COVID-19 pneumonia are pretty low rates, certainly lower rates than compared to influenza. But yes, getting the getting the pneumococcal vaccine may help reduce your risk of getting the invasive strep pneumoniae or pneumococcal disease after you get COVID-19.
Okay, and sometimes I think medicine is guilty of WICs. Now you're going to know. Oh, no, here he's got another acronym. Here it comes.
Acronyms are fun.
Here it's going to be this one. Okay, this is white coat induced confusion syndrome. That's it. WICS, white coat induced confusion syndrome. And what is that about? Because we use terms in different ways and we mean different things, but this sounds the same to the public. So when we say pneumonia, we could mean pneumonia as in bacterial pneumonia.
Yes.
Or we could say the term pneumonia, which is kind of a loose, junky term for you got something in your lung, we don't really understand what it is, and that pneumonia could have been caused by a bacteria. It could have been caused by inhaling a bad toxic substance. It could be caused by virus. Yep. So the problem with the question is that what it really means is that people don't understand entirely how we're using the term pneumonia because it's confusing because we've got WICS, white coat induced confusion syndrome. So listen to this. I read some COVID-19 patients get pneumonia. Yes, but not necessarily bacterial pneumonia. It could just be pneumonia from the virus itself, and the virus causing inflammation and destruction in the lung, which can be loosely called pneumonia. This is a little like, Dr. Bartlett, the confusion on death certificates. When a death certificate says you have COVID-19 and you died of lung disease, you probably had pneumonia caused by the virus, which really just means you had inflammation and destruction in the lung. So I think it's a little case of this white coat confusion syndrome. What do you think?
I would agree. We have a tendency to confuse people. That's what I do. I consider myself a medical interpreter, even for English-speaking patients, because you guys have a tendency to use words that people don't understand all the time.
She's saying that ICU doctors are confusing. Or did you just call us confusing? I think you did, Dr. Bartlett.
I may have.
That's because we're specialists in WICs, and if we make it wiki enough, it makes you have to come back and see us again, I guess. I don't know.
Yeah.
All right. So, yeah, I think that the reality is that pneumococcal vaccine protects you from getting pneumococcal pneumonia. It does not protect you from COVID-19. Now, there is some data out there that says, Dana, that if we get our immune system revved up through these different vaccines, it may actually help us with COVID-19 or from the SARS-CoV-2. I don't know if that's really true or false.
Yeah, that's being looked at prospectively in research studies as well. I find that hard to get behind, essentially because most of the people in the United States have been getting their childhood vaccines so they can go to school. They have probably been keeping up, hopefully, on their tetanus vaccines, which you need about every 8 to 10 years, things of that nature. And we, especially in New York, where the infection rates were so high compared to some other places, especially like here, there were still people getting very severe disease. So that is being looked at prospectively. Is it priming your immune system, your T cells, your B cells, anything else? It's hard to say, but that's being looked at.
How do asymptomatic people spread the virus if they're not sneezing or coughing?
Well, that's the whole point, isn't it? Because as we've shown in the freezer videos, because you and I love being at sub-zero temperatures, when you breathe, you spread the virus. You don't need to cough or sneeze. The virus is in your respiratory secretions. And so I breathe out, there it goes. Now, we don't have a mask on in this room because we're all more than 6 feet apart, and we know that the airflow in this room carries our secretions up and away very quickly. But we know that you spread the virus just by breathing. You don't have to sneeze or cough. It's just in our breath. The virus gets carried out. That's our breath cloud. And you walk into somebody else's breath cloud and you walk right through all the germs that they're breathing out. And that includes SARS-CoV-2. You don't have to cough or sneeze. Yeah,
that's the real crux of the matter. That is probably where a lot of these spreading events occurred because people didn't know they were sick. They weren't all at choir practices. They were maybe at parties. Maybe they were laughing or talking loudly, but they were probably just close together and talking in normal manners, and that's how this virus can spread.
All right. Well, since I'm a very humble and very quiet guy and don't really say much, I'm going to continue. I'm going to let Doctors Bartlett and Hawkinson answer the next question, Jess.
Okay, I'm ready to serve it up.
Let's do it.
All right. Is COVID-19 sexually transmitted or transmitted by kissing? Dr. Hawkinson?
No. I guess that depends how you're having sex. No, so this is a very good. It is not considered a sexually transmitted infection. Okay. Now, can it be spread by kissing? Absolutely. So I think, kissing is just the same as talking or laughing loudly, but you are even closer to that other person. So absolutely can be transferred by kissing. As far as sexually transmitted, although they did find it in semen samples, we did look up this, our therapeutics group and some of our other colleagues did look up the research publications on this. So they did look at it. It can be found in semen, but we don't know if that's replication competent. As far as for women and females, they were, while they were doing all of this information and data gathering on pregnant women, because we know COVID-19 and pregnancy is a huge issue. We have a lot of people, and we've had some of our guests on. They weren't able to actually detect it in vaginal secretions. So at this point, the answer to that is no, it is not sexually transmitted. But can you get it by kissing? Yes, you can get it by kissing.
Dr. Bartlett, anything to add on that?
That's Dana's wheelhouse. So
yeah, that's what I said.
Agree with what he said.
All right. We don't want to have any wicks on this one, so we're just going to let Hawkinson be the final voice of reason and logic there.
How long must we wear masks inside if one person in the family tests positive?
Hawk.
Very good question.
It is good. These are great questions, and they're all Hawkinson questions. I'm enjoying this one.
There is Chinese data to support, and obviously we could understand why, to support wearing masks in the household if you choose to do so. It will certainly reduce your risk. I would say, again, same as when can someone get out of quarantine or isolation if they've been diagnosed with COVID. And really, per the CDC and KDHE recommendations, the big issue here is the 10 days. So I would continue wearing that mask as well as physical distancing as much as possible in that household for 10 days from symptom onset or diagnosis date, probably whichever is longer. The best data that we have is really that somebody is not infectious after about 8 to 10 days. They aren't really having a high enough quantity of replication competent virus after about that 8 to 10 day period. So I would say at least 10 days from symptom onset or positive test, whichever is longer to be safest.
Okay, good answers. And I think we just have to remember that our goal, especially in a family when somebody's tested positive, is just trying to keep each other safe.
Yeah.
So you want to do the best you can.
Is it true that young people with coronavirus can suffer blood clots and strokes?
This is sad, but totally true.
Absolutely true.
And we've seen it here in the hospital. We've had young people who have stroke deficits as a result of coronavirus over the last 6 months. And we're talking 18 to 20, 22-year-olds who have had mild strokes. And I don't know if their lives are going to be the same. We know that they have blood clots in their lung. We know that there's a lot of tragedy and impact on someone's life, even if they've survived COVID-19. Dr. Bartlett, I'm going to bet you've seen some of those folks.
Yes, we absolutely have. And the tricky part is, COVID-19, it causes so many problems in the body. And so it can be hard to initially tease out our mental status changes from strokes. Are they from sedating medications we've had to use on the ventilator? So we definitely have seen strokes, and I think only time will tell what the long-term ramifications of this are. Are these people going to be able to get back to their previous level of function and quality of life, or are these strokes going to cause long-term deficits that will be their entire life?
Yeah, and we don't know. And we know that we've had deaths from it as well, Dana, even in a very young age, in the 18 to 20-year age range.
Yeah, I mean, the thromboembolic disease, meaning basically blood clots, is a significant proportion of this disease. I think the best treatments that we have right now really center on the steroids, the dexamethasone, and the anticoagulation. And I think we really started to learn that from our experience here in the United States, and that's when we started really making changes to institute those therapies. So I think that certainly the anticoagulation, meaning the blood thinning for blood clots, and the steroids, even more than the remdesivir, and of course the plasma, we still don't have very good evidence of if the plasma is beneficial. I think the blood thinners and the steroids are really what has changed since we've started treating these
and
patients.
that's why our outcomes are a little bit, perhaps a lot better at times than they were when we started, and when people started trying to treat this disease in China and Italy and New York City, where the mortality rate was 30 to 40%, and our mortality rate's 8 to 9%. And I think that's because we've learned so much from those things. That the autopsy reports at first things came out of Italy, talking about, hey guys, there's a lot of blood clot in these folks, and I think that's led to an improvement. But that doesn't mean it can't happen. And unfortunately, it can happen even very early in the disease, and it can happen before you get symptomatic. It can be the first symptom is you can have a stroke or a problem with blood clots. So you just have to be worried. That's why we keep saying to you guys, this disease is bad. People want to make it not bad. They want to think it's fake news or it's a hoax. And, that is just not true. And we're here to say to you, we don't make more money because we're seeing coronavirus. Actually, we make less money. And so we're not financially motivated. We're not motivated by politics. We're just here to tell you the truth about what's going on in our place. And we can tell you because we've seen a lot of COVID. And we're just trying to lay it out and let everybody make an informed, thoughtful, non-judgmental decision, apolitical. This is about whether or not you can stay safe in the world of COVID. And COVID can get you, and it can get you early, and it can cause death, and it doesn't care how old you are.
Can I get coronavirus from touching my cell phone or money?
I touch my cell phone a lot, so I'm hoping the answer to this is negative. Although we do know coronavirus lives on surfaces, it's not what your first thought, that's where a lot of the spreading was coming from. We even talked about the doorknob principle early on. Just assume that every doorknob is dirty. But really, it's more aerosolized. It's more about what we breathe.
Yeah, absolutely. I would say that from money, probably not. Again, money is more of a fabric. The coins are probably, more of the heavy metal.
I wouldn't recommend touching it and then eating it.
No,
I
absolutely.
think that's probably a bad idea.
And that's where I'm going. You certainly need to continue to maintain good hand hygiene when touching money. We know that from early studies from up in Nebraska, when they looked at their sick patients, it was found on 80+% of cell phones. So we know that it is on cell phones and surfaces, just as you had said. Touching those fomites or inanimate objects, such as a high-touch surface like a doorknob or a countertop or a cell phone, you can certainly transfer that to your hands. And if it is an allergy season and you're itching your eyes and your nose and your mouth, you can certainly transfer it to those mucous membranes and get the infection. Is it going to be as likely as being in close proximity with somebody who has it, not wearing masks and catching it? No, but there is that small possibility there.
I remember when we were first doing the program, we talked a lot about wiping down your groceries and wiping down packages when they came in the door and all those things. And we talked about that almost more than we talked about masking. And today we know, okay, do what you can, wipe down stuff, but wear a mask. And I think that's still the right thing to say, and wash your hands. I see Dr. Bartlett shaking her head. Anything you want to add to that, madam?
Yeah, I'm still pretty diligent about cleaning off my phone, especially when I'm coming home from the hospital. I may have been a little overly aggressive with that because my last phone died very recently and I had to get a new one. So I'm going to need to maybe back that off a little bit, but I'm pretty diligent about cleaning my phone.
Can coronavirus stick to my hair or beard? How often should I wash it?
Okay, I'm going to be honest. I'm a little clueless on this question. Dr. Bartlett, how often do you wash your hair?
Every day.
I know. I'm just messing around here.
I know.
Today is actually the first day that I've curled my hair in a really long time. So I just like to flip it a little bit. I wash my hair every day when I get home from work, which has become a big pain in the rear. Stites, you probably don't have the problem of getting out of the shower and having to dry a lot of hair.
Thanks a lot for that, but that is true.
Shots fired.
You're not going to have me on here ever again, are you?
Yes, I am. I've enjoyed this. This is great. You're going to be back.
I wash my hair every day, though.
So do I. It doesn't take me very long.
What is today, Friday?
Yes.
Saturday is usually hair washing day for me, so
You
tomorrow
don't-
I will.
You don't wash your hair on
No,
Fridays?
I'm kidding.
Okay. How long
Only
is it-
once a week. Once a week.
How long in your beard and hair? How long does it stay around?
So we don't really have a lot of concern if the virus lands in our hair. Certainly if it's in your beard, obviously that's closer to your mucous membranes. But I would say, again, that is probably less concerning, just as the fomites, the inanimate objects, the cell phones that we're talking about, rather than actually breathing the disease, and especially if the hair is on top of your head, not the hair in your beard. I think washing it once a day, as your normal hygiene practices would go prior to COVID, is certainly going to be adequate.
All right. Now that we've established that I don't have to wash my hair, it doesn't take me very long to dry off.
And I will follow that up with, when I was seeing my COVID patients yesterday, again, I was wearing eye protection and a mask. I didn't have anything on my hair. So
Yeah, I don't. And I'll just say I was in clinic yesterday, and I did not wash, but I did wash it this morning, as I do every morning.
All right, so we're going to get to our last question.
Please.
Just want to let everyone know we've got some really good questions that came in today during the update. So I want to let our viewers know we're keeping track, and we will hopefully get to those next week. This last question is, I'm going to the Chiefs game next week. Am I safe if I wear a mask?
Well, you're safer. There's no question about that part if you're
Yeah.
going to go to the Chiefs game. So first of all, go Chiefs. Love it. Second of all, this is, again, that risk balance question, right? How risky is it? What's my life? What's the balance of my life like? Who lives at home with me? What's my likelihood of getting it? The Chiefs have taken good measures to try to make it safe. There's still a lot of people, though. Mm-hmm. I think it's like 22,000 or whatever the number is.
Yeah.
It's still a lot of people that are going to be in that stadium. And you'll still be around people. And they're trying to keep groupings of seats apart. But when people start standing up and cheering, Patrick or Tyrann Mathieu and the team, then that's going to be a little bit. Those secretions are going to go away. So just be thoughtful. And I think my answer is you should definitely wear a mask. And I think the Chiefs are requiring you to have a mask unless you're eating. It's going to make it a little harder to shout, but I know Chiefs fans, they can get through a mask with a shout. And I would really say to do that. I do think it helps protect everyone else around you. It offers a little bit of protection to you, but it really protects those around you. Dana?
Yeah, I absolutely agree with everything. Yep.
Dr. Bartlett, are you going to the Chiefs game?
I'm not. I would also offer, though, I don't know if they're going to be selling alcoholic beverages out there right now or if people will be imbibing before they get to the game. That's another thing to be very careful about. Sometimes when people are drinking a little bit, they get a little loosey-goosey and they kind of forget that they have to remain diligent with their mask wearing and their distancing. So if you do go to the Chiefs game, behave yourself, watch what you're doing. And also, oh my gosh, Brittany and Patrick Mahomes, I needed some good news in my life. Congratulations to those two on their engagement. I feel like we know each other. I've never met either one of them, but they're just so.
But we're all besties, right?
Congrats
We're all
to you
besties.
guys.
We're all tight. Yeah. Hey, I've seen Patrick Mahomes from a long distance and waved to him. What does that mean, I wonder?
We may have Patrick Mahomes bobblehead. On the show next week.
Oh, that would be kind of fun. All right, I bet he's going to have a mask on. Will he have a mask on? We got to keep Patrick safe.
I mean, the Chiefs provide him with a lot of things, so a mask might be more.
All right. Hey, so Monday we're off, but we're on. How about that? Only here at our magical studio at the Dolph Simons Family Studio can you be both off and on at the same time. And we think this is a pretty cool deal. So we invite you to stay tuned in for a special 1-hour broadcast. Same bat time, same bat channel. Be broadcasting at 8 a.m. Monday morning for an impressive line of experts and others from our community who will share an update about the viral spread and what we can make of an ask of each of you. The chief medical officers of the city came together and had an expert panel with political leaders and others, and we want to broadcast that panel to you. We hope you'll watch Monday. And again, same bat time, same bat channel. I think it's going to be pretty cool. Now, we're going to segue in just a moment to a video that we've promised. For 7 months, we've been trying to find new ways to tell you the same pillars of infection, prevention, and control. And don't start the video yet, because I want to show something. And today, our message is that you have the power. You can be a superhero and help us fight COVID-19. We want you to wear your mask this long holiday weekend. Stay safe. Wash your hands. Cough into your elbows. Stay home if you're sick. Don't go out in big groups. They really are dangerous. Be careful at those wonderful weddings and parties and things that we all want to do, and we know that they can spread the virus and make us all sick. Because we also want to do and remember that this guy right here, he's telling you the truth. What is he telling you? He's telling you to mask up, because if you put a mask on, coronavirus, it can't spread. And what does that do? It creates a fight. We're fighting the good fight because, as Travis Kelce told us, in honor of the Chiefs, and I know I came from the Beastie Boys, but who are they? I'm old. Travis Kelce and the Chiefs. You've got to fight for your right to party. And how do you do that? You be a superhero. Watch this.
Does coronavirus worry you? Never fear if a mask is near.
Coronavirus is weak.
Coronavirus has no superpower. It can't leap tall buildings. It doesn't pass through walls. It does not have X-ray vision. It has no superpower. It is weak. You are strong.
Be a hero. Save lives. Wear a mask. Watch the Morning Media Update Monday through Friday at 8 a.m. Don't be late or you'll miss out.